Hello everyone. Well, today we are here for a live session with Dr. Let me join her.
Hello,
Hi. Hi, Diksha.
how are you? How are you?
I'm very good. I'm very good. How are you doing?
All well. Thank you for joining.
Thank you so much for
Oh,
having me over.
yeah, as you all know, we are here for, as belated World Physiotherapy Day it is. So we are here for the topic osteoarthritis, which I will be hosting and QA by Dr. Ria. So shall we begin or shall we wait for more people?
Let's wait for more people to join and then we can probably begin in a minute.
Fine. Fine. So I would like you to introduce yourself to the audience.
Okay. Hi, everybody. I am Dr. Ria. I am a master's in physiotherapy in ortho and sports from Manipal, and I have been in the industry for about 10 years now. I was a consultant physiotherapist with Apollo for 3 years, after which I was working with one of the biggest sports medicine center in India called Spark. I was working with them in Chennai, and then I moved to Bangalore to head the Bangalore Center for about 2 years. During this
Wow.
time that I was heading the center, this is where I actually started to learn about virtual rehab, virtual therapy, assessment, consultation, rehab. Post I quit my job. It's been a year that I have quit being head of Spark, Bangalore, and I have now started virtual therapy, rehab, assessment for people around the world. So now I have clients in the Hong Kong, US, UK, Australia, Europe. So I have clients all over the world, and this is a
Not bad.
this is a great thing that a gift really that we have gotten that we can go ahead with treating people all over the world, with the internet. So,
Absolutely.
uh, yeah, and I am a reader, avid reader. I love going through at least 5 articles, which I think I have to thank my Manipal professors for just like getting it into me that, I love reading. I read 5 to 6 articles on a regular basis to keep myself abreast because as physios, what makes you stand out is really your knowledge and being up to date
Absolutely.
with the recent
Yeah.
current things. Yeah.
Hu- Huge round of applause to you.
Thank you.
Okay. So I'll give my small introduction. I'm Dr. Diksha, MPT Neuro and a celebrity physiotherapist. I also worked in Bangalore, Manipal,
Oh, great.
and
My college.
yeah. And after that, I switched to Mumbai and I worked with Dr. Ali Rani sir in Nanavati.
Oh, great.
After
Wow. I'm a huge fan.
actually, and after that, I worked in some film industries also with the actor Shah Rukh Khan and all for in the role of
Oh,
physiotherapist
great.
only, not as actor.
Great.
Now I'm working with one very good venture, which is Parasha Healing. So yeah, today I will be hosting you, and
Wow,
I'm
great.
glad that so many audience have joined us. So let's begin. I guess let's begin.
Sure.
So basically, can you just a small introduction that what topic we will be talking about?
Okay, so today we'll be talking about sports injuries. Now, I have had over about 7 years of experience just working with sports injuries. I have taken care of a lot of athletes. I was previously also doing some lectureship for Sai, and I have got the chance to work with a lot of badminton players, international, national level from Padukone Center. Now, the problem with sports injuries is, the way we treat it. Now, usually it can be very tricky because the athlete always wants to get back into playing, get back into their performance as soon as possible. So this is a very important topic, and it's important to stay abreast with not just acute injury rehab, but how to move ahead and how to reduce the risk and prevent further injuries also. Also, a very common question, and since this is the theme for this year's World Physiotherapy Day, osteoarthritis, I wanted to talk about the prevalence of osteoarthritis in runners. There's a huge myth that running can cause osteoarthritis or it should not be done by people who have the risk. So I wanted to chat a little bit about the same.
Okay, perfect. So let's begin. As you know, what is osteoarthritis? It is a degeneration of joint cartilage, which usually happens basically due to obesity, due to, old age and stress, on the stress, joint stress, we can say. So because of that, osteoarthritis is happening nowadays a lot, especially for the knee joints. Most of the patients complain about knee joint pain. So let's begin. What are the current guidelines you want to share about acute injury rehab?
Okay, so acute injury rehab. So when I started practicing, when I was doing my master's, we were following the RICE protocol. Now, in 10 years, the entire, everything's changed about the acute rehab. So what used to happen is we went from RICE protocol to PRICE protocol to police protocol, and now there is a new protocol which has come up. This was published in 2020 by the Journal of Sports Medicine, the British Journal of Sports Medicine, and it's called Peace and Love. So why did we need a new protocol in the first place? Number one, the previous protocols were mostly talking about only immediate action that should be taken. Okay, rest, ice, compression, elevation. This is absolutely the most basic thing that happens in the first 1 to 3 days. Now, what after that? Nobody was talking about the subacute as well as the chronic stages. How do we take the rehab ahead? And unfortunately, as physios, we are not really taught much about strength and conditioning. So there is a difficulty there because I've worked with strength and conditioning coaches in the past. So there is a difficulty because we are usually under training or underloading an athlete who needs to go back to the team and play. So what does Peace and Love stand for? This is an abbreviation. So let's get started with this. First, P stands for protect. Okay, definitely this is the same as before. 1 to 3 days of protection so that we make sure that it is not getting injured any further. Okay, then comes E. Okay, E stands for elevation, that is elevation of the injured area above the heart level so that the interstitial fluid can flow out. Okay, then next is A, and this is a shocker for most people. It was a shocker for me as well. A is for avoiding anti-inflammatory. Now, we would all know that whenever we have injuries, we'll be going to the doctor and the doctor will give us an anti-inflammatory immediately. Okay, take this, NSAID, go. Okay, and have this for 3 days. Or they will tell us, do this icing, go. Now, from 2015 onwards, not just NSAIDs, from 2015 onwards, there have been a lot of studies done on icing and how it can actually delay healing. Now, we all know when we were studying physiology that inflammation is required because you have your macrophages and everything coming to the site of the injury and actually healing it. Okay, this is very important for the healing process. Now, what happens when we are doing icing or when we are doing NSAID is we are actually stopping the body's normal process of going through the inflammation and healing the area. So we delay healing. This is what a lot of doctors, a lot of expert scientists have seen all over the world, that when we have not gone forward with giving any kind of icing or NSAIDs, people have seen faster recoveries. So avoid anti-inflammatory. Don't go ahead with giving any anti-inflammatory. I don't even advise icing for most of my clients, I advise them movement from day one, because movement currently, what the research is going on, start moving the joint as soon as possible. That's the best way to go with it. Okay, so then comes C. So PEA. Now C is for compression. You can do a bandaging, or you can go forward with anything that can help reduce the inflammation. A lot of people will be telling that, okay, we are avoiding anti-inflammatory, so what happens with the swelling that comes up? So compression can take care of the swelling without really hampering the healing process. Okay, so this is actually a brilliant way of taking care of the swelling that happens post injuries. And then last is E. E is for education of the client. Now, there's a very recent study which showed that most people, 57% of our patients, get better even with placebo treatments. You know why? Because they have trust in that treatment. Okay. So education
Absolutely.
of the client, really telling them, giving them the confidence that they are going to get better, that they will be able to get back into playing. This has such a positive effect on the person, and they are able to get back, especially for athletes. I mean, their life, their bread and butter depends on them going back to the field and playing. They might lose their job, they might lose their position, their rank, so many things. So they are under tremendous psychological trauma. Education with what treatment will work, active mobilities will work, passive techniques, just passive stretching or foam rolling is not going to help so much. Start with active exercises as much as possible. That's very important. So this was the peace protocol. Now love. So love, LOVE, stands for the second stage. Okay. This is like really showing some love to your
I
client's
think
injuries.
this is very much new to the audience because
Yeah,
this article has not been, heard about so many people. So it is a
correct.
very good idea to, understand people and to understand the patient that how it matters. Yeah, go
Yes,
ahead.
yes, absolutely. And even I was very surprised when I went through this article. It just debunked so many things that we were going ahead with previously. So what does LOVE stand for? So L starts for loading. Optimal loading of the tissue helps in recovery. We all know that post fracture, if we need to recover somebody, we need to put a little bit of weight bearing. Even a lot of good doctors, they start with weight bearing from day one. Even after a TKR, they start with weight bearing from day one. I've worked with
From day
Manipal, and I've
one.
seen doctors, yeah, do this from day
Yeah.
one. So this is so effective. So optimal loading of the injuries, even when the athlete comes to your clinic or to your hospital or wherever, make sure that we are starting with physical activity and loading from day one. This is so important. So L stands for load. O stands for optimism. Okay. Make sure that they have a plan and they are looking ahead. If psychologically they are not feeling good, the prognosis is going to be really bad. So be optimistic, receive your client with a smile every day, and show them what you can see in their rehab, that they're getting back to playing again. Optimism is really, really required. V stands for vascularization. Okay, that is building up of new blood vessels. This can happen the best way if we are putting our cardiac system into work. So, cardiovascular activities, or starting with aerobic training. If a person has a lower limb injury, cannot really do weight bearing, please start with hydrotherapy, something that can take the weight off. If the person has an upper limb injury, make sure that they are able to do some lower limb aerobic exercises. This helps in building faster building of capillaries. Okay, so faster blood supply to the area, faster healing. And along with that, the last E actually comes for exercise. Okay, active exercising, not passive techniques. Now, I am a manual therapy myself, a certified manual therapist, and I actually do not use manual therapy for a lot of my clients unless and until it's absolutely required, and only in the initial stages of pain healing. Because when it comes to subacute and chronic stages of pain healing, the person does not need manual therapy. They need active loaded exercises, and it's really when you need to give the strength and conditioning coach a chance and work with them, work towards the fitness of the client to be able to get back to the field playing as soon as possible. So guys, this was the 2020 new protocol given by British Journal of Sports Medicine. It's called Peace and Love. Please look it up. It's a 2020 review. If you go online at PubMed, you'll be able to find this study very easily, and make sure that you are following this for injuries for your clients.
Wow, so much informative it was. So, if
Thank
you
you.
guys have any kind of questions, you can ask over the comment section. You can ask if you have any kind of queries or anything, you can ask us. We can revert you back. Okay, so the next part we are coming up, that does running increases chances of OA in athletes? Because most of the doctors recommend that stop running. If you have a OA condition to athlete, they usually say just stop running. You don't have to run. So, what
Yeah.
is your opinion and what do you want to share about it?
Okay. So, first of all, I do not know where this myth came from. There have been a lot of studies that show that osteoarthritis does not come from running, nor can it be aggravated. Okay, so I'm just going to talk about four recent studies which were done. One was done in 2017. The 2017 study actually said that running was not caused by osteoarthritis. The running does not get affected by osteoarthritis. Okay, and in fact, the osteoarthritis can actually start to come down with going ahead with regular running. So they can actually be a remission in symptoms. In osteoarthritis, people are not really concerned about the degeneration. People are concerned about what is causing them to stop the activities of daily life, like they're walking or going to the grocery store or running with their dog, playing with their kid. These symptoms can come down when the person is more physically active. This is what the 2017 study said. Along with that, there was a study done in 2018 which said that if we are checking runners and non-runners, and we are checking the risk of osteoarthritis as well as the symptoms of osteoarthritis, okay, non-runners are going to have a higher risk. This actually completely changes the myth, because we used to think that, oh, a lot of running is going to lead to degeneration. But guys, if you don't use, I mean, I keep saying this to my clients, if you don't use it, you lose it. So it's the same that
Absolutely.
works for muscle. It's the same that works in every department, whether it be, a neuro PT or ortho or sports, everywhere. If you don't use your muscle or your body part, you're going to lose function of that part. So non-runners will have a higher risk of having OA than runners. In the same study, they were also checking whether competitive athletes who were running too much were having OA. So in this particular study, they saw there was a higher chance of competitive athletes getting OA. But so this is one thing that I would like to address, that whenever we are seeing a study, we always see the limitations of that study. Now, this was a review which was done, and we were not able to understand that whether competitive athletes had a pre-existing problem which gave them OA, or whether OA was caused due to running. So correlation does not mean causation. This is very important as health professionals to understand how to be able to decipher each study, because each study has its own limitations. And then thankfully there were more studies in 2021 as well as 2022. 2022 one was a systematic review which checked 20 studies previously and 12 individual RCTs which was done. And they said that all physical activity, okay, whether it be walking, running, recreational sports, like we have people, right, going to play badminton on a regular basis, or tennis or cricket, all recreational activities, none of this was going to cause OA. None of this was going to increase the risk of having osteoarthritis, and they were actually going to help in relieving osteoarthritis. So as and when, with all of these studies that I have stated, and these are only the highest evidence studies that I've stated, there are so many more. All of these suggest one thing and only one thing, and that is that OA will not happen if you exercise. OA will happen if you do not exercise, and the worst will be the symptoms. So please make sure that you are educating. Again, taking more things from
Yeah,
peace and love, educating your client about the risks of not doing exercise, not building enough muscle, and all of the repercussions that that can have.
perfect. So hope everyone's myth is being cleared now that running in OA is good for you. Means you have to do
Correct.
exercises. You don't have to stop
Yeah.
exercise that ortho or any other doctor suggests you not to do exercise and all. It is a myth. So this has been evidenced by the articles which Dr. Ria has told us. Okay, there is one question. Kashika has asked, what do we do in the inflammatory stage if we don't use ice or antacids, and what movement should be done?
Okay. So coming to the first part of the protocol, okay, that is peace. Okay. So you protect, okay, you elevate, and you compress. Okay, these three things will take care of the swelling part. Automatically, when you're giving compression and elevation, it will help in drainage of the interstitial fluids. Along with that, what activity should be given depends on the injury that the person has had. For example, I have treated recently a lot of clients with ankle pain and even athletes, recreational athletes with ankle pain. Now, ankle pain is very, very commonly seen, especially the lateral ankle sprain, which is seen. Now, we need to check what movement the client is able to do. And most often than not, if there is no fracture or if there is no kind of, severe or grade 3 injury, the person will be able to do certain amount of movements. Definitely the toe movements will be available. So they will be able to go ahead with, clawing of toes or going forward with extension of toes. And they can go ahead with moving their knees, their hips. They can probably go ahead with a little bit of pronation and supination without any weight bearing. So these are very simple things. And plus, along with this, start with toe touch weight bearing. Okay, that means that start loading the area a little bit so that more oxygen and blood supply comes there and starts to take care of it. So this is very important. This is there in the first part of the protocol itself. The peace part is all acute. Make sure that you're making use of this. Start with dynamic stretches. We see a lot of people doing active stretching or passive stretching by giving, like a cloth and keep pulling it, maintain it for 10 to 15 seconds. Please don't go ahead with static stretches for people who have just gotten injured because the capacity of the muscle is very less. So let them work within their pain range and do only the amount, like for example 2 to 3 reps of ankle movements they're able to do. After that they're not able to do, so let them do that every 2 hours. This will increase blood circulation there. It will help in healing. Okay, the movement will help relax muscular spasm that would have kept them from going back to the field. So this is going to really help.
Okay, one more question is there by Syed Ali. When the love protocol should be started? When can we
Okay.
start the love protocol?
Okay, as soon as the initial swelling settles down, within 3 to 7 weeks, 7 days, sorry. So acute phase of each injury is 3 to 7 days, okay? And usually from 7 to 21 days of an injury that the person has, athletes has got in the field. So 7 to 21 days is a subacute phase. Subacute phase is where you can easily start with the love protocol, okay? Usually it's taken together and it is up to the discretion of the therapist who is taking care. All injuries are not the same. Some injuries, the swelling may stay till a week. So please go ahead with protection, compression, elevation, all of that, and move it only slightly, probably non-weight bearing. But once that is feeling better, immediately move on to loading. Optimal loading, it can be slight weight bearing, it can be movement, it can also be resisted exercises depending on what level of injury the person has and what they are able to tolerate. Athletes are usually able to tolerate better because they are used to training. So with athletes, we are able to work much faster. Probably in 3 to 4 days, we can start with loading easily.
Perfect. One has asked for the muscle recovery, what is better? Ice water or cold water? Sorry, ice water or hot water?
For a muscle recovery, we don't need to go ahead with ice water or hot water. Okay, we just need to let the inflammation take its course. Again, follow the protection, compression, elevation. Along with that, start with movement. Movement itself, whenever we have a swelling which develops, movement itself helps in clearing out the inflammation. So start with movement. neither ice nor hot pack. Start with active movement of the area. If a mobilization is required, depending again on the kind of injury, mobilization also help in reducing the inflammation. So check what is required: mobilization, manual therapy, or go ahead with active exercises.
Perfect. Okay, so let's move on. We have another topic, which is injury prevention and how we can prevent it for stress fracture or overuse injuries, how we can prevent, especially what all we are missing for the recovery, for the prevention.
Okay. So, do you want to take the question now, or shall I just answer this question first?
Uh, okay, there is one question by
Yeah. So,
Okay. If a runner is suffering from OA, how do we make sure that he runs pain-free to reduce OA? Good
first of
question.
all, first of all, usually the pain does not really comes from OA. The pain comes from the muscles around the joint being not very strong or flexible or have the strength or capacity to be able to take load. So when we are talking, for example, we're talking about the knee OA, okay? So what we see in the X-ray are only bones, okay? Now we have all seen hanging bridges, right? We've seen the bridge in San Francisco or the Howrah Bridge in India. Okay, so what happens is, who pulls the bridge apart? The suspension wires or the cables. In the body, the suspension wires or cables are your muscles. Okay, so the pain is usually coming, if the pain is coming on the medial aspect of the knee, it is usually coming from the PAT group, that is the pes tendon group. So try working with manual therapy over the PAT area. Along with that, start loading the knee in non-weight bearing positions. More so, start working on the hip rehab as well. Most people getting pain over the knee might not just get pain because of the knee, they will be getting pain due to restricted hip range of movement or difficulties in ankle or core. So don't just work at the pain area itself, work on other areas. Degeneration is normal part of the process. You, me, like Dr. Diksha, everybody is going to have degeneration. Okay, degeneration is not going to be the cause of pain. Pain is coming from severe weakness or tightness or lack of stamina, endurance of the muscles. I have seen, we all know Fauja Singh, who's running at 105. So how come at 105 years old he's not having OA and he's able to run? Because he is a runner. Okay, he has strong muscles to be able to run. And then we have like 40-year-old people who are not running or not doing exercise complaining of OA knee. So degeneration is not choosing people. Degeneration is choosing weakness. Wherever there
Weakness,
is
yeah.
weakness, the symptoms are
Hmm.
higher. So start with strength training. Okay, this is really going to do wonders for your client and they will be able to get back to running. Do running specific exercises. Okay, do exercise for hip flexors, make sure that they are strong enough. Work on the ankle mobility, especially the big toe mobility, and see that the range of motion is complete at the hip and ankle, and the knee pain should go away with that.
Perfect. Okay, hope Kashika got her
Yeah,
answer. So let's continue. So we were
yeah.
talking about injury prevention, overuse injury, and stress fracture, which is happening in athletes. Okay, so what are we missing?
Okay. So, stress fractures are very commonly seen in athletes. And what happens is, usually the first and foremost thing, this I also encountered when I was doing my research for the size presentation on footballers. So there was this very interesting study that happened that footballers were having constant injuries and they were not getting better. Okay. So what happened was, there was a control group and an experimental group. The experimental group was just given rest, sleep and just rest it out and don't exercise and don't go to the field, and people recovered with rest. It's not
Wow.
just physical rest that we are talking about, it's also rest from the psychological pressure of constantly being on field or training 6 to 8 hours. A competitive athlete is at least training 6 hours in a day, at least 5 to 6 days in a week, and they'll probably be running a lot. The same has been seen in runners. Okay, there was actually this study done in 2021, which was checking running injuries for the New York half marathon. Okay, what they saw was people, there were two problems which were leading to injuries. First is people who were training for more than 4 days. That means that your training runs should not be more than 4 days in an entire week. 3 days, out of that 3 days, 1 day should be rest day and 2 days should be strength training. No runs. Okay. So 4 days, if people were training, they were having less injuries. Okay. Or almost nil injuries. Number two was longer distant runs. So, of course, you need to meet a particular mileage if you're going forward with a long run or probably a marathon. So, you need to finish your mileage in that 4 days of training. So, people who were going ahead with longer runs in each day rather than going ahead with 5 days or 6 days of running of a shorter period, they were having less injuries. So, have more rest days and run longer in your training session so the person has enough time to rest and recuperate. Rest days is one of the major problems that, every industry, not just in India, all around the world, people, athletes are not getting rest days, and that is why they're getting really injured. So 4 days of training, longer runs led to less injuries, and also finishing the marathon at better timings. Number two was in 2022, there was a systematic review done in the Human Kinetic Journal. So whenever we are training, and most of the physios would agree with me, whenever we are training somebody for a marathon or a long run or an ultra marathon, one of the most common runs we see is tempo run. Tempo run means
Yeah.
they are going to be running at their maximum pace, okay? So that they reach their lactate threshold and to be able to stay at that level without feeling tired. Okay, now this is also known as threshold training. Now, the new systematic review in 2022 has said that the threshold training or the tempo run is actually not very effective. And unfortunately, most of the marathon runners in the world are following threshold training. So they are having their easy runs, their tempo runs, as well as their long runs at the end of the week. So what training is actually recommended? First is pyramidal training, and second is polarized training. Let me just give you a gist
Mm.
of this. You should go and have a look at this 2022 article. It's from Human Kinetic Journal. So pyramidal is like a pyramid, basically. Okay, you start heavy, okay, and then you start tapering down your intensity of the run and then repeat it again. This gives the body the ability to go up and down. We have seen this kind of variation when we are even talking about circuit training, when we are looking for fat loss. We would have all seen that people who are varying their intensities of exercise are actually able to lose more weight. That means they are able to burn more calories and do better, right? The same happens for a
Absolutely.
runner, which is why tempo run is not very efficient. Going forward with changing your intensities is actually the most efficient form of training. And the next one was polarized training. Polarized training is actually a much lower, moderate intensity run. It doesn't matter what level that they are training in, according to that distance that they need to cover or the pace that they need to keep. It's going to be a moderate intensity run to focus on easy to hard distances. Okay, this is basically decided by 3 zones depending on the pace at which the person is running. Now, I'm sure everybody would know how to understand pace. So you will usually see like 6, 1 dot, and then 2 and double dots. So this will be like the amount of time that it is required for you to finish a kilometer or a mile, depending on which pace you're checking. So depending on that particular pace, this pyramidal as well as polarized training is decided. So please go ahead with checking this article. This is going to be very, very helpful if you're working with athletes and runners, footballers, anybody who is has a lot of running in their training. Along with this, there are very basic guidelines that we need to follow. First of all, there should be an assessment done to check for their nutrition. Okay, what are they eating? First of all, a lot of athletes are under eating. This fasted cardio and fat diets, it is not just seeped into our society, it is also seeped into athletic society. Why? Because they need to maintain, a gymnast needs to be a certain weight, or a boxer needs to be a certain weight category. There is so much of pressure on them to fit into that category and to stay light that most of them are not eating properly. So nutrition and hydration, vitamin D3 and B12 should be correct. Calcium should be good. And for females, especially the female athlete triad, okay, check if the female athletes are getting their periods regularly, okay, or are they missing it? Are they underweight? So these are the most important things that we need to see biologically for male as well as female athletes to see whether they are at a risk of developing an injury. Because if a female is not eating properly, she's missing her period, she's definitely not having enough calcium, she's heading towards osteoporosis very, very early, she can easily have a bone stress fracture. Okay, along with this, for a runner, pace your run every week. The next week, don't increase more than 10% of the previous week mileage. So start early, start slow, build up your strength slow, go forward with easy runs. Tempo runs are not very effective. Along with that, strengthen the hips. Now, there was a recent study done. I will find that article, but I had gone through that, and there's a recent study done where mostly for knee pain, no, we always try to focus on the knee. Okay, let's do some IFT at the knee. Let's do a little massage, a little taping,
Yeah.
something at the knee. But
Mm.
people completely disregard how important hip is. Okay, a hip range of motion is so important when you're going forward with running. So 96% of the clients who came with knee pain, athletes who came with knee pain, actually reduce the knee pain just with going ahead with hip rehab.
Hip
This
thing.
this was a very,
Mm.
very interesting study where just getting full range of motion and strength throughout the range for hip was able to reduce the pain in these athletes. So this was a very interesting study. If I get the study, I will definitely share it on the page. You guys can go through it. And along with this, guys, I would again come back to peace and love protocol. Please start training your athletes as soon. The more they are inactive off field, okay, the higher the chances of them getting injured when they go back on field. So don't give them clearance too early, but don't stop them from moving around and doing their
Mm.
rehab. Okay, this is very
Mhm.
important. Mostly what happens is, unfortunately, I keep hearing this a lot from even the athletes who come and visit me or recreational athletes that they were told that, okay, they have an ankle sprain, just keep the leg up and don't do anything about it. And like after 2 weeks, you come back to me. 2 weeks is a very long time. The person can go through detraining. Okay, if the person is having detraining, their bones will have less calcium deposit. Okay, there is less blood supply going through that area. They are going to be at a higher chance of injury when they get back into training. So avoid detraining. Go ahead with active recovery. It's the easiest way to get them back on the field ASAP.
Wow, so much informative. Well,
Thank
only
you.
Kashika is asking questions. I don't know why others are just quiet. Okay, so her next question is related to physiology, which is what is the success rate of PRP, HLA, or stem cell therapy in athlete, and how can we increase the chance of success with physical therapy?
First of all, why are you going ahead with stem cell therapy? It's very specific to the condition what we are trying to take care of here. If we are looking at injury and injury rehab, there is absolutely no requirement for a therapy like this. And this is where our job as physiotherapists is really important. Okay. We need to assess what are we treating. The minute we know that we are taking care of a physical injury that happened due to physical causes. Why do we need to go forward with stem cell therapy or a PRP injection? Okay, I don't go ahead with promoting any injections or any treatment because number one, I am not an expert in those treatments. Okay. I, as a doctor, have my expertise in physical therapy and physical rehab. And if it is under my control, I will be going ahead with a physical treatment. Most injuries get better with strength training. Most pains get better with strength training. You just need to start it off. So before you think about going ahead with any treatment, whether it's a stem cell therapy, whether it's a PRP injection or steroid injection, which a lot of people go ahead with, or whether you are planning of going forward with acupuncture or dry needling or even manual therapy, ask yourself, okay, not what I can do. Okay, as a physiotherapist, I might know 100 ways of treating, but what does the patient require at that time? Okay, usually if we are talking about an athlete, okay, the athlete needs to go ahead with playing as soon as possible. And there is literally no injection in this world that will help that. The only thing that will help is strength training from day one. So use your head and see how can I strength train him from day one? How can I avoid any kind of detraining? And there is literally no kind of injection is required. Again, this question needs to be a little specific because then I'll be able to give specific answers. Probably we can have a Q&A coming up on the weeks. So, and
Yeah.
sorry. So I was saying that probably we can have, people send in questions over the week. We will put up an AMA again, as we had put up last week, to get questions from people, whatever you guys want. You want more studies to be put up in the group, or you want to know about any specific condition, I will be more than happy to answer that.
Perfect. Okay, so hope everyone got their answers regarding osteoarthritis, especially in athletes, because so many people having myths regarding this. So, apart from that, we are closing up. Now, before closing up, we wanted to share about webinars also we will be conducting. So, do you want to share anything regarding that, Dr. Ria?
Yes. So I actually wanted to let everybody know. First of all, thank you so much for joining in today. And this was a live session where we wanted to talk about something which was like something that we deal with every day, sports injuries and, injuries with athletes. So I wanted to check with you guys. Please let us know what you would like to have another webinar on. A webinar is obviously going to be a lot more detailed explanation. It can be specific to a particular joint, a particular injury that you have been facing a lot. Like, for example, it can be about a rotator cuff injury. What are the recent advances, or an ACL injury, or anything that you guys would like to know about in detail with, how to do an assessment, how to go ahead with, the special tests, how to check what should be your prognosis of any condition. Please let us know how to go ahead with the webinar.
Thank you so much for joining, Dr. Ria. And thank you, audience, for
Thank
listening
you.
us. Peace, all the patients. Thank you so much. We will be coming live soon with other topics. So just thank you. Thank you so much. We'll be ending this live. Thanks a lot.
Thank
Thank
you,
you, Dr. Ria.
everybody. Thank you, Dr.
Okay.
Diksha.
Bye-bye. Take care. Yeah.
Bye.